Hey, Dr. Otto Janke here with the Empire Longevity Insiders Longevity Live. This is April 12th. Very welcome to have you on board. Let's talk about some of the healthcare costs that go along with being an American. Healthcare costs. I'm gonna give you some numbers, and I really hope they set you back for a little bit and you say, like, son of a, I had no idea. Whoa. The number of retail prescriptions that were filled in 2022 was 4.76 billion prescriptions filled in 1 year. 4.76 billion prescriptions were filled last year. If we divide that by the 330 million Americans we have, that means each person, man, woman, child in America is filling, I'm going to round up to the number, just make it easy number, 4.6 to 15 prescriptions a year. 15 prescriptions a year. We as a country don't reach longevity. We don't get healthier by filling more prescriptions per year. I understand that the whole ideology is that, well, we need this because we're not healthy. How ironic is that? 15 prescriptions a year the average American is filling. If we look at over-the-counter medications, you're spending over $75 a year on over-the-counter medications. Over-the-counter medications equals approximately $24 billion a year. $24 billion a year. It's expected to go up to $33 billion by 2027. In 5 years, it's going to go up another $7 billion. I just had to put that together. Holy cow. Excuse me. Almost $8.5 billion. It's going to go up in 5 years. What possibly could be going on with us that we are going to increase the over-the-counter medications by $8 billion more dollars? You'll be spending over $100 a year just on over-the-counter medications. I myself are on no medications. I'm on no prescriptions. That means there has to be someone who's living in Passaic, New Jersey, who's on 30 prescriptions. Don't you see that absolutely we have to look at that and say, my dear Lord, can we address the absolutely humongous, it's not an 800-pound gorilla anymore. He's much bigger than that. The 1,800-pound gorilla in the room is that we have a drug problem. It's not the one that's on the streets that's going to be most detrimental to us. It's the one that's doled out by a prescriptive pad. I'm a firm believer that we as a country cannot be reaching our true longevity, our true health and vitality by having more prescriptions. You know, we talk about the ones, kind of the big ones that are being prescribed now are like Ozempic, and Wegovy, and metformin for weight loss. Don't we see that there's a massive problem if we're having a multi-million or billion-dollar industry for weight loss? Don't we see that the problem might be a little bit bigger than how to get a better prescription? Don't we see that? How do we take care of this? How do we decrease the amount of monies that America spends on healthcare? Well, the tough thing to say, but it's the most reasonable thing to say, the most effective and the most cost effective, is ironically to get healthier. And how do we do that? This ain't rocket surgery. You've heard me say this a million times. This ain't rocket surgery. By no means is this the toughest thing to do. It's different. Doesn't mean it's hard. It's just different. But for America to get off of but let me ask you, well, so I started following the retail prescriptions filled. I started following that a few years ago. At that time, it was 12. It was 12. Americans were averaging per person. Every person in America was averaging filling 12 prescriptions a year. Now it's 15. It is anticipated in a few short years, it'll be 17 to 18 a year. Every person, you look around, you're at the shopping, you're at the grocery store, you're at a traffic light, you're in the movies, take a look around. Each person is filling 15 prescriptions a year. How do we decrease that? Understand there's a whole profession, whole industry that's built upon you having more medications. I'm not denying that some medications are necessary, but how many medications are primary? And then the second, third, fourth, fifth, sixth, seventh, eighth, ninth, 10th, 11th, 12th, 13th, 14th, and 15th are prescribed to cover up the symptoms from the first or second one. How many times could a demonstrative change in lifestyle decrease our need for those medications? I'm not saying I'm never going to be in need of medications, but I know that how can Americans, each American, have such a necessity to fill 15 prescriptions a year? How can that possibly be logical? And that number is just going up. We see in the realm of anxiety and in depressions. The articles coming out are showing that exercise, good hard exercise, is just as effective, if not more so, than the anxiety and depression medications. I don't see our local gyms being flooded with people who are getting prescribed to go there for those reasons. I don't see it. I'm at my gym all the time. And not because I think I'm becoming a bodybuilder or anything like that. Them days be gone. But I do it because there's so many other benefits to exercise. It's one of those things I call a compounding health factor, in that we do it for one reason, but we get a whole bunch of reasons coming off of it that are beneficial for us. Positive side effects, compounding health factors. How can we get you to be one of these people who aren't on 15 prescribed medications a year? Again, it's already expected they'll be up to 18 within a couple of years. Again, when I was doing this a short time ago, I was reading these numbers. It was 12, it was 11 and a half. Now it's 15. It will be 18 in a short period of time. How long before it's going to be every American is on prescribed 2 medications a month? When are we going to start prescribing health? I'm in a small town in upstate New York. And I work with both of these facilities. One is the big hospital in town. The other one is a hospital company. Well, the big hospital in town is a hospital company. Very well known worldwide. Excuse me, well, probably worldwide, but definitely in America. And the other one's from a community over in which their hospital system has grown very big. I'm in a small town upstate New York, a college town in upstate New York, and these 2 hospital systems are just duking it out for my small little town. Why is that? Here's the other question for you. Are we healthier for that? Are we healthier for those 2 companies building a lab? Here's the honest is I'm glad there's a lab right down the street, so now I can start sending all my patients get lab work and see how messed up their D3s, their omegas are, their different blood levels, so we can start getting them healthier. Ironically, and I'm a doctor of chiropractic, I'll tell you right now, I have patients come into my office all the time and ask me, what exercises can I give them to help them to not be in my office? And I said, well, the very first question I asked them is, how much are you exercising? What? How much are you exercising? Like, I thought you'd give me like some back exercises. No, I want you to exercise. I want you to get to a gym, get healthier, get an optimum weight, get in the best weight you can. Because there's so many other benefits that go along with that. It's a compounding health factor. There's so many other benefits for that. I just thought I'd do like some back stretches or something. It's not what you need. I'm not saying those aren't effective, but I mean, my dear Lord, you want to turn off the smoke alarm or put the fire out, build the house to be better, then paint the place so you can live there for the next decades? Of course you do. But we look at this and the commonality of response to me is, well, people just want the quick fix. Bullshit, they do. Now, if people look at me and say, we don't? No, you don't want that. Well, what do we want? You want to be able to kick ass for as many years as possible. Yeah, that's what I want. You want to live, laugh, and love as much as possible. Yeah. You don't do that in more medications. I don't? No. You do it by getting healthier. Not that you run marathons, but that you get healthier. And I understand we have to help you get out of pain sometimes because the house is on fire. You got to put the fire out and turn the smoke alarm off. I get it. Before we rebuild the front and back porch and before we paint the place and get the shutters working good. I understand that. And sometimes that does mean giving you those back exercises. Great stuff. More than happy to describe them, show you how to do them. But what we really have to do is get you healthier. You want to decrease your time in my office, in every doctor's office? Make no need for it. I think I have a unique opportunity in my office in that we optimize how your body functions. You don't get optimized by filling 15 prescriptions a year. I'm not even sure you're turning off the smoke alarm. I know you're not putting the fire out. The big conundrum in healthcare. So then you look at this and say, wow, 4.7 billion, 4.76 billion prescriptions filled in a year. Oh, no wonder why those 2 companies are duking it out for my small little town in upstate New York, small old college town in upstate New York. Oh, no wonder. Are they helping us be healthy? That's not our job. Our job is to fill the prescriptions. Oh, okay. So it's up to you and me. It's up to you and I to make sure we're the healthiest we can be. No one else seems to care. And that's the truth. I'm Dr. Otto Janke. Let me know how I can help you. And thanks for being with us on the Empire Longevity Insiders.